This is a patient instructional video on the first time we issue aligners in orthodontic sequential aligner therapy. We're using ClearCorrect in this case. This is a sample prescription that comes through from ClearCorrect, so we're up to step 1. And you can see here the different steps, and it indicates what we need to do at each step. Okay, so that's that part. Now, what we've got is, and what I normally say to my patients is, all right, so here we have this little container, okay? This is where you're going to keep your aligners, all right? And inside there we have a couple of things called chewies. These are chewies. These chewies, so I'll just undo that. These chewies are a little rubbery type of cotton roll sort of shape thing. And there they are, squeezy. So what you do with this, when you put your aligner in, you grab one of these on each side like this, teeth together, and you chew. Chew, 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 gently to get the aligner down into place if it's not fitting. Usually I find my patients report to me that the aligners won't fit down at the back when they change them, and they'll be maybe sitting up for a day or two, but then they'll fit down. So don't need to know if you need these chewies or not. Here's a little card in here, says talk to us if you're having trouble. Wear your aligners 22 hours a day, 7 days a week, so except for when you're eating and drinking. Okay, this container here, there's only 2 spots that your aligners live in. One is in your mouth, okay, and the other one's in here. Never keep them anywhere else because you can lose them or break, or they can be lost. A dog can pick them up and chew them, or your cat can take off with them. All sorts of things can happen. Okay, so I'm going to give you this little bag, lovely little ClearCorrect bag, and we'll put your little thing in there and your instructions in there and your chewies in there. Okay, and I also provide these little handy hooks. Okay, there, see these little handy hooks here? So I just open it up. It's a pre-packaged one. They're really hard to open up, so I just take these instruments out of here, tear the bag, open the hook up. So how this works is you just pop it on your finger, like that, and if you've got the aligner in there, you just place it under the aligner and pull it down. It gives you the ability to take your aligner off, okay? So I'll pop that in here as well, in this bag here as well. In your little aligner case, you can keep that with you all the time. Yeah. Okay, so here's your first set of aligners, right? So that's how they come, packaged like that. So what I'll get you to do is, I'm going to give you number 1 and 2 today. When you're opening them up, you just tear it a little bit on the edge and pull them out through there. Okay. So the reason why I get you to just tear it a little bit is when after 2 weeks, when you finish with this, you need to clean them, put them back in here, fold it over, put a little bit of tape there, and that's your number 1 aligner. See that? Number 1 aligner. So it's written on there. The other thing is your aligner, if you have a close look here, you can see there's a case number and then a -1U. So it's 1 upper, and this one here, case number -1L. That allows you to identify the aligners when they're out of the mouth. Okay, so here we go. Big teeth for the top. So we just come in and have a look how we were just fitting these aligners. They're pretty simple. Just put them over and click, they're in place. And for the lower, click, they're in place. Okay, how does that feel? Weird?
Yeah.
You're going to lisp a little bit for a couple of days. You might salivate a lot, and but that's it. That's your treatment that started now. Okay. So we'll make an appointment for 4 weeks' time, and we'll see you then. Thank you.